average cost in Alberta for hospitalization is $9,200. That being said, those 3,000 people cost the province $27.5 million for COVID-19 because they were sick and had to be hospitalized. You know what it would cost that 3,000 people to get a vaccine? $33,000. Hey everybody, and welcome back to Consider This. Today what we're going to be talking about is Alberta and their new mandate on vaccinations for COVID-19. Now, I know a lot of you are like tired of COVID-19, vaccinations and whatnot, but there's a little bit more to this than people understand in the direction Alberta's going in with their healthcare system. So some of you probably don't know, Alberta is going to start implementing a fee for people who don't qualify to get the COVID-19 vaccinations going forward. Up to this point, the federal government has been covering the costs, and now they no longer are, and it's up to the provinces. So because of that, Alberta is going to have a policy to pick and choose who they want to get the COVID vaccine. Now, there's some validation to their method, but at the end of the day, it all boils down to money. It has nothing to do with the protection of Albertans. So their justification as it stands right now is there was $135 million waste of the COVID-19 vaccine. And what had happened was, or what has been happening is, when you first puncture a vial of COVID-19 vaccination, you have 12 hours to use that vial up. And the number of people that are going for their vaccine has dropped, which is understandable. So let's say someone who goes into the pharmacy, their doctor's office, whatever, they ask for their COVID-19 vaccination. They open up a new vial, they get one, and that's all they have in terms of demand for the next 12 hours. That whole vial that could have probably done 50 patients has only done one, and they have to throw it away. I don't understand how this is a problem. Well, let's first go over this. Alberta didn't have any issues with that when the federal government was fitting the bill. So when somebody else was paying for it, indirectly, they were still paying it through the taxes, Albertans, but it was coming from the federal government. They didn't care because it wasn't coming out of their budget. Now that it's up to them to pay for it, now there's a concern, which is BS to me. There should have been concern in the beginning. There should have been solutions to this when they were seeing this as a problem. And a simple solution is single-use vials. Don't get a vial that has capability of doing 50 patients. That was relevant when the pandemic was going on. Just because people were lining up to get it and required it. So you weren't going to have any waste. Now it's up to the individual to choose and come and when they want, which is great. It's fine. That's what it should be. You choose or not to choose, you come, but it should be paid for by the province. Single-use vials. Work with the manufacturers. You don't think they can do it? A flu vaccine, like traditional influenza, will last 28 days. So this is why Alberta is still offering the influenza flu vaccine to everybody and anybody, because there's no waste. It's going to be used in 28 days a vial. But the 12 hours is a problem. So now they're all worried about the money. And that's what it all boils down to, is money. The people who are going to be getting it and covered are, high risk. They don't really say what high risk is, but they mention compromised immune systems, which is high risk. But what about people who have high blood pressure, overweight, diabetics like myself? Get the flu, COVID, whatever. It fluctuates my sugars like nonstop. It could be going where it stays high, I can't do anything about it, or it stays low and I can't eat enough to keep it from going too low that I pass out. As a diabetic, you want to keep your sugars as normal as possible. So the best way, especially when you're sick, is not to get sick or to minimize your exposure. Would I be covered if I was Alberta? Right now, there's nothing out there to let me know that I would. I would have to pay the $110 that would come out of my pocket. And then, of course, seniors in nursing homes and retirement homes. Great. What about the nurses there that are watching over them? What about nurses and doctors in hospitals? What about if I had my parents who are elderly living in my house? Can I get one for free? And then people on social programs, the ones who can't afford the $110, which is great. But again, in this day and age, with inflation and everything else, $110. Who's got that extra money to a certain degree to go spend it when they want to make sure they stay healthy or the people around them stay as healthy as possible? $135 million of waste is a lot. But when you look at it this way, from last year of August of 2024 till now, there has been 3,000 people who have been hospitalized due to COVID-19. Average cost in Alberta for hospitalization is $9,200 per day. Oh, sorry, no, it's not per day. It's the average stay. That's higher than the $7,800 on the average stay in a hospital across Canada. That's a separate problem for Alberta. That being said, those 3,000 people cost the province $27.5 million for COVID-19 because they were sick and had to be hospitalized. You know what it would cost that 3,000 people to get a vaccine? $33,000. There's waste right there. Let alone 368 people died of 368 people died of COVID-19 last year. Influenza, 198, which is up 175 from the previous year. It's actually been the highest in the 16 years for just regular influenza. And hospitalizations due to influenza was 3,200. So COVID-19 is technically, depending on what you look at, hospitalizations or deaths. Deaths is worse. Hospitalizations is the same as influenza, but they're not covering it anymore for the entire population. So if you're going by the numbers don't make sense for them to start charging $110. But there's more to this. This has nothing to do with anything but just pure money, or I think just hated the idea that they were mandated to take the COVID-19 vaccination back during the pandemic, and it's trying to stick it to the Ontario government in a roundabout way. So another reason, on top of the $135 million of waste, which can be solved easily, again, single-dose vials. Daniel Smith had said the province had thrown away over 1 million doses of the COVID-19 vaccine because people just don't want to take the vaccine at the same rate as others. Okay. Let's see why. Smith was asked why that is. Quote, I think it's because it doesn't work particularly well. If you want the truth, a vaccine is one where you get an injection once or twice, and then you never develop any underlying condition. And so you have to judge vaccines on that basis. What are you talking about? Okay, traditional vaccine. You take 1 to 2 doses depending on what's recommended and how it's been developed. There's always some sort of reaction to any vaccine depending on the person. Some people don't feel it. Some people get muscle spasms. Some people don't feel good because your immune system is reacting to what's been injected into your body to a response, an immune response, and that's what a vaccine does. Is initiates a immune response. So the body says this is a foreign agent. We need to get rid of it, and now we've recognized it. So when the actual disease, you get the actual disease or virus, your body's well prepared. So there's always going to be reaction. Now, I understand what she's saying in terms of people still get sick with COVID. But there's always a mutation. So when you do, if there was no mutation whatsoever on COVID-19, there would have been only one vaccine, everybody would have taken, and there'd be no more issues anymore. But the problem is it mutates every single year or through the year or whatnot, just like the influenza. So when everybody's taking one portion of a vaccine, by the time it goes through the population, it's already started to mutate a little bit. So you're still protected, and that's what the goal of any vaccine is to keep you alive and out of the hospital. Because that's a drain on the system and resources. What do you think happened during the pandemic? The hospitals were overrun. So people who actually needed the hospital, there was no room. Heart attacks, cancer patients, accidents. Everybody heard about the stories where somebody was in a car accident, had to go 3 different hospitals because they were overrun. And people died because of that. So this idea that it has to work, it does work. All the data shows that. This idea you take a vaccine, you don't feel anything, that doesn't exist. She's stupid. She's just stupid. I don't know how else to explain or be diplomatic on it. Or she's placating to those extreme followers of hers. In 2022, Daniel Smith appointed a panel, people she chose personally, to report on COVID-19 response and data collection. And of course, during that time, she was a staunch critic of the pandemic rules and vaccine mandates. Again, because the liberal government told them they had to do what they had to do, and she doesn't like that. If it was a conservative government, they were doing the best. They know what they're talking about. Liberals, anybody else? No, they're stupid. In this 269-page report, it calls for the government to halt COVID-19 vaccinations without full disclosures of risks and to end their use for healthy children and teens. First of all, there's always a disclosure of risks. They didn't say, take this vaccine, we're not telling you anything about it. Never happened. Second of all, be wary when someone says, the children. We always have to think about the children and their safety. Every time I hear that, I'll be honest with you, all I think about is Maude Flanders on The Simpsons. Just, somebody please think about the children. They don't care. Or I can't say they don't care. It's really not their concern about healthy children and teens. And what do you mean healthy? What do you consider healthy? Somebody who's just not taking medication? Their kids did die during COVID-19. Healthy kids. Very few of them, 100% understand that. But there were still deaths in the ages of children and teens. What about measles? What about mumps? When we give those vaccinations to those children, they're healthy. So this idea for we shouldn't give them a COVID-19, again, up to the parents. But now, with this mandate, the parents have to pay, but they wanted to just end the use for children and teens. So this had nothing to do with science. Also, during this report, it recommended legislative changes to give doctors more freedom to prescribe alternative therapies in future pandemics, saying health authorities were too restrictive when it came to off-label medications use. Oh my God, they're talking about oh my God, you can never say this. Ivermectin and hydroxychloroquine. Okay, used for arthritis, and then of course the parasite medication, horm dewormer. And yes, you can call it a horse dewormer. You can call it a horse dewormer because the ones used for horses and ones used for humans are the same recipe. The only difference is the concentration. It's almost like regular strength Advil and extra strength. It's just more of it, but same ingredients. So they want to give the option for doctors to give this. Never worked, any of it. No study, nothing. In the beginning of the pandemic, it looked like something was working. They studied it, they did clinical trials, and the data showed it did nothing. This is not going in the right direction for Alberta. You got measles going on right now. 900 cases. I think it was saying 40 years, the highest in 40 years. And why do you think it's happening? Because people are not taking the vaccine. Because of this idea that it has to work. There has to be no side effects or anything. What are we doing here? Why are we listening to this stupid? Don't even listen to me. Go to an actual expert, your doctor, a physician, people who are in this every single day. And of course you're going to find doctors, nurses, whoever, that say, no, the vaccine doesn't work. They're putting a chip in our brain and everything else. But what are the majority of the consensus of the professionals say? It's safe. It works. Those are the people you need to listen to. Not these stupid politicians that are just placating to the fringe of conspiracies of vaccines. Because they're trying to put, again, I don't know how many actually believe this, but chips, control, whatever. But let's look at it this way for you skeptics that are watching right now. People like you cause problems for authoritarians, for people who want to take control. They want people like me who listen. So how would they get rid of people like you? Do you think they're going to release a virus to give a poison to people like me who are beneficial to their control? No. What I think my conspiracy hat would be the better idea of what would happen is they release a virus. They put out this misinformation for people like you that are hard to control so that you don't take the right medicine. And the ones that are going to be easy to control will take the medicine. And the ones that don't will die. And that's the easiest way to get rid of people like you. That makes more sense than the control pill or tracker or whatever that's in the vaccine, we don't know what's going to happen in 10 years and it's going to start being mass deaths. No, they want people to work, to make money, to do whatever they want them to do. They don't want those people to die. People like yourselves who have these mass conspiracies, who don't want to listen to authorities, who think they know better, you're a thorn in their sides. They're okay with you not taking the medication because they're okay with you not surviving. That seems like a better plan or a better story. Let me know what you guys think. If you have any concerns, what you think you're going to be able to do to change the mind of people who think this is okay. And how is this not looking like it's going towards a privatization of insurance and healthcare like the states have, because it's working well with them, eh? A lot of people are surviving, getting better health care than us. This is, again, another thing that I think is happening, that is just trying to unload the cost to individuals and not let the province take care of it. Let me know in the comments. Take care, and we'll talk later.